You're a good-looking crowd. And, right? Yeah. I have to tell you, I'm so fortunate I get to work with this amazing team. I'm going to talk about cancer prevention, what you need to do. It's really simple. It's really straightforward. The second thing, when I walked through and I saw Charles, the food smells great. I'm really getting hungry here, and it looks great. So you're lucky to be here for that. My grandmother was really, and I'm getting there, was amazing. She always was really coy about things that made me think about what I want to talk to you about. And so my grandmother always caught me on this knock-knock joke that I hate. So I want you to participate in that, because this is what she did to me every time I'd see her. And I got a call all the time. Knock, knock. Says me. So I want you to listen to me. I'm going to talk about women's health first and cancer prevention and just some simple things. Women, the most common thing that women die of in this country is not breast cancer, as Dr. Brobbey talked about, and as Dr. Bubb and Keyonna will tell you, it's heart disease and all related to obesity, but 1 in 8 women in this country will get breast cancer. 1 in 8. You look around here, 1 in 8 women, and we know that certain populations of certain ethnic descents don't have the same outcomes. The only way you can do this, and we see this, is to get your annual mammograms, do your breast exams, and do that every month, your breast exams. You should be getting your annual mammogram at age 40 unless you have a family history. But at age 40, get your first mammogram, and it's every year after that. It's so important. If we can catch you early detection, we prevent breast cancer. I came out of, I've been practicing here in Southern Nevada 24 years. Prior to that, I did research in breast cancer. And when I was doing research, there were a large number of women that would die. The reason you hear so much about breast cancer, and the reason that you see all the marches, women survive breast cancer. And that's because they go get their mammograms and their yearly exams and such. And we also know a lot about genetics now, and that's important. The other thing in women's health you need is just see in women's health your annual physician, and up to a certain age you need to get your annual cervical cancer screening, and we recommend that all the way up until age 50, and then it gets to graduate after that. But it's very important because cervical cancer is on the rise in this country, especially amongst many ethnic groups as well. And again, if you don't get that preventative exam, what we see is 5 times as much cancer-related deaths than among other populations, especially Caucasians. So it is not fair, and like I said, you deserve to get your care, you deserve to get prevention, but it's all about prevention. Now this goes in men and women, but colonoscopy, it's so important to get your annual colonoscopy starting at age 50. Who got their colonoscopy this year? No, don't raise your hand. I really appreciate that. That's cool. Some people don't even want to hear the word colonoscopy, but you guys are, that's good. So, didn't mean to get jumped on. Last thing I want to talk about is just one thing related to, from a women's health standpoint, is also in men's health, is just like a number to remember is 1 in 8 women get breast cancer, most common cancer amongst women. 1 in 8 men will get prostate cancer in this country. And once you hit age 65 and above, it's 1 in 4 men actually start to develop prostate cancer, and beyond that, and after age 70, it's 1 in 3. And again, we see in different ethnic populations where the death rate amongst men, because they just don't go to the doctor like they're supposed to. We need you all to get them to the doctor, right? You have to drag them in with their leg kind of behind them, but get them in and get these screening exams because it's so important. But 7 times the death in prostate cancer in men among ethnic populations, especially what we see with this population. So, with that said, I just want to get those messages out. I get to work with this great team at Intermountain Healthcare. I'd like to hand it off back to Keyonna. And thank you for having us today. It was really great. Thank you.
be so glad the masks are not a part of our life anymore, won't you? You don't gotta match it with your outfit no more. Get out the car, walk to the store, gotta walk back to the car because you forgot your mask. I'm so tired of masks. Thank you so much for having us. My name is Keyonna. I'm the Chief Nursing Officer at Intermountain. So happy to be here with you all. I'm really just reinforcing a lot of the messages that you just heard. Diet and exercise, and I don't even want to call it exercise because the word exercise is overwhelming for some people. You feel like you got to be going to the gym and having a big treadmill at home and things like that. Be active. It can just be walking around your block every evening. It's the activity that we really want you to focus on, not so much having a big exercise routine. And so important the choices that you make on your plate. And that starts with shopping. And most of you are probably the shoppers for your homes, right? And so it's really gonna start with you. And if you don't bring it in the house, that's right. Nobody's gonna eat bad stuff, right? I have to portion for my kids. I'm like, y'all can have one thing of cookies this week and that's it. So you really have to start at the grocery store making good choices. And that can be, when you go to the grocery store, try to stay out the aisles. You might have to go on the aisles for like the spaghetti noodles and things like that, but around the outside of the grocery stores where you're gonna find all your freshest foods, all your fruits and vegetables. So just try that. And it doesn't have to be an overnight, all of a sudden tomorrow I'm eating grapes. I got the best diet ever. Start slow. Start once a week implementing something different, having more vegetables on your plate that week. It just has to be a slow progression till it becomes a habit. Don't let it overwhelm you. Many of us grew up, I use this analogy, my grandmother would be in the kitchen with a cigarette in one hand, stirring a pot with the other hand. And so, we want to get away from those habits of tobacco use and adding so much salt to your food and things like that. Because, your taste buds so used to that salt, you forgot what food tastes like when you start to have a low salt diet. So do it gradually. Try the McCormick, the salt. Try not to use so much of salt. Garlic powder and things like that, you're just gonna have to train your taste buds. I promise, if you do it for a month, it'll become a habit. You can change your dietary habits no matter what the food that you grew up on was. There are things that as I got older and I actually watched my grandmother making something in the kitchen, I was like, oh, that's how much butter and salt went into those mashed potatoes. So it really does start with what you're buying, what you're bringing home, how you're preparing your meals, and stay active. The other thing that I want to share with you all today is COVID. It's respiratory season where we see a lot of COVID and flu. And for our seniors, it's a more vulnerable population. If you get sick, you may not do as well as someone who's younger with less medical problems may do. So we are all healthcare professionals. We've read all the research and looked at all the things, and we endorse the vaccine. We encourage you to get vaccinated. The disparities that you might see, and don't always listen to news headlines.